What's up, guys? Dr. Mo here, Digital Nomad Physician at digitalnomadphysician.com. So I got this great question from a podiatrist, and he says, this is on my website at digitalnomadphysician.com. I'm a podiatrist, and I want to do health coaching. How do I pick my niche? He mentioned the niche, and he wanted to know if that's specific enough. So let's dive into that. Welcome. Any podiatrists of you out there who are listening to this, you are fellow physicians and do incredible work for people. Let's first break down the difference between being a physician and being a health coach. As a physician, you diagnose, treat, prescribe, assess, evaluate. As a health coach, you guide. You just guide someone. You're helping them with their habits, their behaviors. You're having long conversations, discussions. You're educating them, you're empowering them. Yes, you do some of this as a physician, but the way healthcare system has kind of evolved, what we do mostly in healthcare has become prescribing, assessing, diagnosing, and treating. And so there's very little room left for the other stuff. So the first question to ask yourself, why is it that as a podiatrist, you're even wanting to go this route of health coaching? For this particular person, his or her main concern was the risk of being a physician. And I suspect it's the risk of doing procedures, the risk of diagnosing someone, maybe getting a lawsuit because of it. And it is absolutely true that healthcare right now, the way it stands for physicians, most of what we do, the risk is not well compensated. And that is why we're seeing a lot more lawsuits and burnout. So when the risk is not well compensated, it's very normal for a group of these doctors to move into alternative careers. One of them is health coaching. As a health coach, you have to understand that your clients are not looking for a diagnosis. They're not looking for a treatment, but they are looking to improve their condition. They're looking for your expert guidance to help them improve. For that reason, a niche is incredibly important. So as a podiatrist, you have several niches to choose from. Thinking off the top of my head, there is plantar fasciitis, there's hammer toe, there is bunion. You can probably discuss gout. You can discuss arch pain and tenosynovitis. You can discuss lots of ankle issues. And you can probably discuss more athletic stuff like footwear selection for trail runners versus rock climbers versus endurance athletes versus cyclists. All of these things are in your wheelhouse. So we're kind of now going into the discussion of the niche topics. And so picking one niche can be picking a particular condition like plantar fasciitis. It could be picking bunion pain or bunion issues. It could be picking ankle pain or Achilles tendonitis. It might even be just choosing female athletes, male rock climbers. You can get that specific, especially if the niche is kind of has enough people in it that it would be of value. If you did foot pain and lawn bowlers, is that a thing? Then you're probably not going to find a lot of people. And the nice thing about health coaching is that you don't need a particular state medical license to practice in that state because for now, health coaching is not a regulated thing. It's not that it's not regulated, but there's no certification requirement. Chances are someone's going to come up with a certification requirement, pass it through the government, and that's going to get regulated. Maybe it's a good thing, maybe it's a bad thing. Who knows? The next thing you got to think about is how do you find clients? The best way to find clients always is to go where they hang out, right? Runners hang out in runners clubs, cyclists hang out in cycling clubs, they hang out in cycling shops. They go to sports medicine doctors, they go to physical therapists. So you don't want to do something that's taken business away from somebody else, but there might be a physical therapist who is dealing with somebody with plantar fasciitis, and they're like, look, we do some of these general interventions, but beyond that, if they're more complex, we don't really know what to do with them. And that's where you can come in, give them some presentations, whether virtual or in person, and say, hey, I have this protocol that I created that I go through with these individuals, and then I will send them back to you, or I will kind of take over the management. So that's a good way to find clients, really partnering up with different entities, I think, whether it's athletic clubs, sports clubs, specialty sports groups, and physicians, clinicians, orthopedic surgeons, everything you can imagine. There's an orthopedic insurance-based practice isn't going to want to take over a plantar fasciitis besides, hey, I gave you an injection, I did some ultrasound, get the fuck out of here. So that's where you can really take over. The next one I have here is the services that you can offer. And I think this part is important because we forget. We think, okay, I'm a physician, I do surgery, I do injections, procedures, I prescribe medication, I diagnose, I order some tests. But when you're a health coach, there's a lot more that you can do. You can recommend supplements. That could be a whole program in and of itself. You can recommend topical treatments. That can be a program in and of itself. And when I mean program, I mean it could be a system that you create that somebody can enroll into. So yes, Mr. Ashori, I will help you with your plantar fasciitis, which I had before. It was horrible, but it went away. But you can also enroll in my topical plantar fasciitis course. It talks about everything that you can do topically. Of course, you and I are going to go over that, but that's really going to be the best thing if you're going to ask me questions about like, hey, what topical treatments work, what doesn't. And the course might be just $25, $50. It doesn't have to be like my crazy expensive course that I have. And now you can have other people who may not be working with you directly, who stumble on your website, stumble on your social media, and they find that course and they're like, hey, this is a great place to start. And the course should be priced low enough that people say, oh, this might be a great podiatrist to work with as a health coach to help me back on track, to help me with my chronic foot pain as a runner, my recurrent ankle sprains as a rock climber, which I'm dealing with. So I think courses could be group sessions, they could be individual sessions, they could be all the different tests that somebody could consider. It's a lot of different courses that I think you can offer. And finally, the last thing I would leave you with is to have a good understanding of what is the reason that you're doing this health coaching. What is it you're trying to achieve? If you're just trying to make money, there are many easier ways to make money, in my opinion. If you're going to do health coaching, there should be a part of you that likes working with people and likes marketing yourself. Because one of the questions I put down here in my notes is, how are you going to find these clients and how are you going to keep these clients? Marketing is finding clients, but the keeping of the clients, to have them keep coming back to you and then recommend you to their colleagues, that's going to require a little bit of that personal touch. You really got to get into that psyche of people and like really connect with them, form that bond, give them support, empower them. So I think that piece we're not as good at as physicians because patients are an endless supply. People have drank the Kool-Aid when it comes to Western medicine. They believe that Western medicine is going to cure them of all diseases. Even though chronic diseases are on the rise, everybody believes that they're going to get cured. So I think this other piece is pretty critical. So if you're interested, go to digitalnomadphysician.com. You can book a one-on-one session with me if you want to run your situation by me. I have an online course for starting your own virtual medical practice. I do discuss health coaching there, but it's more about starting your own virtual medical practice in the US. And subscribe to this YouTube. My podcast is great. Tons of stuff coming out there. And that's it, guys. Take care.